Okay, hi class. My name's Tom. I'm a psych mental health NP student here at Rocky Mountain, and I'm presenting a developmental history for Sam and Sally, who are 24-month-old multi-ethnic fraternal twins. So for HIPAA protection, I will refer to them by these pseudonyms to protect patient identity and confidentiality. The history here was obtained via an interview with the mother, and the primary reason for this clinical eval is the mother's concern regarding Sam's delayed expressive language and Sally's recent increase in severe temper tantrums. So section 1, the pregnancy and the birth history. Pregnancy was spontaneous, dichorionic, diamniotic twin gestation. Of note, the maternal grandfather was a fraternal twin, which aligns with the genetic research on twinning, that while a male obviously can't hyperovulate, he can carry that genetic trait and pass it on to his daughter, causing the trait to appear to skip a generation. So aside from the twin gestation, the pregnancy was unremarkable. The mother denied any complications such as bleeding, high blood pressure, or infections. Routine ultrasounds were performed, showed normal concordant growth for both fetuses. The mother denied any exposure to tobacco, alcohol, rec drugs, and only took standard prenatal vitamins. And also, according to the genetic studies, it aligns with this study, that the fact that the mother carries that hyperovulation gene. So unless a genetic test was done, we can pretty much assume that is the case. So as far as intrapartum delivery, the twins were delivered at 38 weeks gestation, full term, planned vaginal delivery. We'll call Sam twin A. Birth weight was 6 pounds, 8 ounces. APGARs were 8 and 9. Sally, we'll call her twin B. Birth weight was 6 pounds, 10 ounces. APGARs were 9 and 9. So both infants transitioned well. There was no NICU stay, no jaundice, no respiratory distress. Both infants were breastfed initially before transitioning to formula at month 4. Gross motor skills and developmental milestones. Both children met gross motor milestones within the normal ranges. They rolled over at 4 months, sat alone at 6 months, crawled at 8 months, walked independently at 12 months. Currently, both children are highly active. They can run well. They're beginning to jump with both feet. Sam's starting to climb a little bit, and little falls here and there. So mom's trying to keep him from climbing on things. But neither is pedaling a tricycle yet, and coordination is rated as average. Fine motor and adaptive skills. Both children appear right-handed. Pincher grasp has been achieved by 9 months of age. Self-feeding, both can use a spoon with a mess and drink from an open cup. Scribbling, both can scribble spontaneously. And toilet training, the family has begun potty introduction, but neither child is consistently trained yet. They're both diapers. Language and social emotional skills, the home is bilingual. Sally achieved her first word at 10 months. She currently has a vocabulary of about 30 to 40 words and regularly uses 2-word combinations like more juice or damn pan. Sam did not speak his first word till about 6 months, and he currently possesses roughly about 10 words, but does not yet combine them. He relies heavily on pointing and grunting. Sally is experiencing intense temper tantrums daily, often involving breath holding, huffing, and puffing. Sam is more on the quieter side, but exhibits significant frustration when he can't communicate all of his needs. There's no history of pica, nightmares, or unusual attachments. Section 3 with the synthesis component. So we have 24-month-old twins, very healthy, full-term birth history, clear genetic predisposition for twinning via the maternal grandfather. While Sally's development is pretty much robust, Sam's expressive language delay is the primary clinical concern today. So given the bilingual environment, a delay is sometimes expected, but Sam is currently below the 24-month threshold for word count and combinations. So my recommendation is for a formal audiology screen and a bilingual speech eval for Sam alongside behavioral support for Sally's tantrums. And this concludes my presentation for today. Hope you enjoyed it. Please feel free to comment below. Thanks.